Hi, welcome to COVID-19 Lake Norman and North Mecklenburg briefing call. This is John Bradford. Today is Friday, April 17th. I'm a small business owner right here, two businesses in North Mecklenburg. I'm also a former member of the North Carolina House of Representatives, and it's my pleasure to bring you these series of calls. The purpose of the calls is to bring together healthcare experts, government officials, business leaders to provide regular COVID updates to educate and support our North Mecklenburg region during the outbreak. Just a reminder, 30 days to slow the spread. This started as a 15-day initiative, and then it got extended another 30 days. So we're going to push this through the end of this month. The bottom line here is if you feel sick, stay home. And if you're older, stay home and stay away from other people because you're a higher risk category. Two good websites, cdc.gov, coronavirus.gov. We're still under President Trump's social distancing requirement through April 30th. As you can see by the graphic here, keeping yourself separated really does make a difference, and this graphic really can quickly show that. If you need any cotton face coverings, you go to shop.enderamills.com, a North Carolina-based company, $2 per mask, 12 dozen minimum order plus shipping costs. My masks are in. I've had several people order them. They're high-quality masks. You can wash them. So if you need them, here's the phone number as well as the website. The CDC does have a self-checker out, a coronavirus self-checker. It's kind of similar to what Apple has done with the CDC, but you can go to cdc.gov and click on the self-checker and start that. And it will help you make decisions about the appropriate medical care that you need. It's not intended for diagnosis or treatment, but it is a tool to help guide. Of course, you still have Apple's tool, which is apple.com/COVID-19. So that's another resource at your fingertips that you can use for yourself or each other. As of yesterday at 4 p.m., 630,000 cases, a little more than that in the U.S., 31,000 deaths. Of course, these numbers are almost a day old already, but that's the latest data that I have. FEMA has a rumor control website. There are no new rumors posted. There are several rumors that are posted, but no new ones. I always like to talk about the new ones. So check out FEMA.gov, go to their rumor control, stay up to date on that. Just don't be scammed. No one has money for you. The Treasury, the IRS has it, but no one else. So don't get scammed. We are, for the SBA, Paycheck Protection Program, as you see on their website right here, there's a lapse in appropriations. They're out of funding. $349 billion is gone. Over 1.6 million applications, 1,000 private banks were used. Great example of the private sector working hard to get this money out to small business owners. There are still small business owners that need money. And we'll learn about that in a moment because we have Congressman Greg Murphy with us. The economic injury disaster loan, same thing. There's been a lapse in appropriation, so no more applications are being taken at this time. In North Carolina, still under a state of emergency. The number of deaths, 152. It was 131 yesterday. What's interesting is the number of hospitalizations is down. Yesterday, 452. Today, it's 429. Those are just two data points, but and then the number of counties is holding. 93 counties the other day, 93 counties today. So who knows? Maybe we're getting towards the top of the curve here. I guess time will tell. 93 counties impacted, still under a stay-at order, executive order from the governor. We need healthcare volunteers in North Carolina, and if you need unemployment benefits with the state, here are two good websites to go to. And there's an initiative right now, Reopen NC. This is a website that's out there on Facebook. They've got almost 50,000 followers, Reopen NC. Hear from you. What are your thoughts? lkntogether@gmail.com. Send me an email. Tell me your thoughts, lkntogether@gmail. And Mecklenburg County, before we go to the congressman, we're at 1,098 positive cases, 21 deaths. Mecklenburg County extended its stay-at-home order to align with the state's order. So there's now alignment there. And remember, about 10 days ago, Atrium and Novant were saying they needed a field hospital. Yesterday, they sent it that now they do not need a field hospital. They're going to have capacity within their system. So that may be, again, another good sign that we may be seeing some flattening of the curve. Who knows? Time will tell. County parks are closed to vehicle traffic, but walk-ins and bikes are still permissible. And then last thing is the heat map here for North Mecklenburg. Still cases here in the North Meck area. You can see this data is a few days old. This is the latest data I have to share with you, but there are clearly cases in the 3 zip codes here in North Meck. Now let's get to Congressman Greg Murphy. He's from the North Carolina 3rd District. Also a Davidson alumnus. He's the only practicing, I think, physician in Congress. Congressman, and Doctor, great to have you here today. Tell us just give us a quick update on what you're seeing and hearing, and then I have some questions about some funding that could be coming to help us with the PPP program.
Well, great. Thanks, John. And thanks again so much for doing this. This is, as I've said before, it's so important that people get out good information and understand what's really going on with the entire situation. We've been on a journey since January. It's been a difficult journey, at times really trying for a lot of folks, not only on the medical side, but as we're finding out now on the financial side. There's more than 16 million individuals now on unemployment here in the country. And, it's a difficult time. There are signs in North Carolina that what was done was effective, but I also think there are avenues now that we can start to intelligently reopen certain businesses and activities within the state. I think, to be honest with you, I think if we continued another month like this, we would be past a tipping point in the state's economy and in the state's health and well-being. And I think that we can use what we've learned so far and be able to move forward, to get people back to some semblance of normalcy. Our normalcy in the future is going to be a different normal for the foreseeable future. But if we embrace the measures that have taken us on a good journey so far comparatively with other states, I think we can do that. So happy to answer any questions. And again, thanks for inviting me.
Yeah. So let's talk a little bit about, I had Congressman Dan Bishop on the call about a week ago, and he said there's a clean bill to try to add another $250 billion for funding specifically for the Paycheck Protection Program, but that there was some resistance by some of the members of Congress to do that because they wanted to tack a lot of stuff on. What are you hearing? What are you seeing? Because the SBA has shut it down, right? There are businesses, Congressman, I know because I'm hearing from them because I'm a business owner, that said, I did not get my money. I went to my bank on the 3rd of April like I was supposed to. I got my application in, but they've run out of money. So what do we tell them?
Yeah, and that's a challenge. That is definitely a challenge. This was a highly popular program. I think last count was over 1.3 million loans were approved. The $350 billion initially allocated has been taken up. And Senator Mitch McConnell last week, a week ago, presented a clean $250 billion bill just as a tack on to add money for those small businesses that were not able to access the capital and the money that they needed. Unfortunately, which is very frustrating. And to be honest with you, it's past frustration. It's the point of I'm infuriated at it. That people are trying to see this as an avenue to push an agenda other than what the COVID crisis is demanding. And, there's time to discuss those times, by all means. It's not like the Congress is going anywhere, but I really think it's just criminal that people are trying to divert the attention away from where it is. We need to get our economy stabilized so that when we do come out of this, and we will come out of this, that we can have an infrastructure still present to carry forth the greatest economy in the world. So it's very, very frustrating that there are forces that are doing that.
Yeah, it just seems, Congressman, it just seems like common sense. We're talking about an up or down vote to do a clean bill to extend, right? To extend additional monies for a program that was highly successful. There are still business owners that did not get funding. This is not political, right? The COVID virus is not Republican or Democrat. This is an issue where we need money for small business owners. Small business owners are the backbone of not only the North Carolina economy, but the United States economy. And I don't understand how someone would not be willing to go in and just give a thumbs up vote to extend $250 billion. It should be a 3-minute vote. Turn on the clock. Everyone's got 3 minutes vote. Yes, we're done. So keep it up. I hope you'll keep pushing, as I know you are. Again, scratch my head on that one. That's for sure. Let's talk about, let's move in business, Greg. I always have to think about setting goals for myself. I think about setting new sales goals. I want to set revenue goals because that's what the private sector does. We set goals, we grow. So let's talk about setting goals to try to get back to some normalcy, try to get back to opening. So talk to me about the different risk groups, right? We have seniors. Obviously, they would probably be, not the first ones to start easing back into society because of the fact of their age and their risk level. But what are your thoughts around some sort of easing back into getting to, reopening, if you will?
Yeah, and I think that's important. I put out, I've tried to do a fair amount on social media to try to educate people because, as you said earlier, I am a physician. I wear 2 hats, and I've studied this virus and all of its healthcare ramifications, for the better part, more of 2 months. And so looking at the data, I think it's very important We're learning as we're going, but that doesn't mean we shouldn't examine as we go also. So if you look at North Carolina specifically, for those individuals that are symptomatic, that we have testing, that their physician has said, okay, well, you may fit the picture of being positive for COVID-19. About 7% of those individuals test positive. So it's about 1 in 15 that we have an index of suspicion. Now, there's one study that came out of Duke that said of just a general population, 10% are showing that they've been exposed to the virus already, which some of that fits in because we know that the vast majority of individuals who get this virus, over 80%, have minimal or if any symptoms. So, we know that it's been out there. We know a lot of folks have been exposed to this already and don't even know it. But then let's look at the endpoint. Let's look at the hospitalizations. And then the final endpoint, unfortunately, are those that succumb to the disease. If you look at different populations, about 25% of the people infected are those age 65 and older. Fortunately, in North Carolina, those age under 18, the number of people who have been infected have been minuscule. I mean, actually, the Health and Human Services website said 0. But if you look at those individuals that have been infected and then succumb to the disease, over 80% are age 65 and older. And so that is our high-risk category. And looking at national data, I was reading some of the national data yesterday. You look at risk factors of those individuals 65 and older. And, everybody's talked about comorbid illnesses, heart disease, lung disease, diabetes. The biggest risk factor in those age 65 who succumb to the disease is actually obesity. And so that goes across all ethnicities. It goes across every boundary in that regard. So it is folks who are obese and 65 that really do the worst. So let's talk about what is a smart thing to do. Well, in the end, we're going to need what they call point of care testing, where if somebody needed surgery or we needed to know immediately, has this person, do they have the virus or have been exposed to the virus? We need point of care testing. That's going to take us there. Are we there yet? Not quite. It's been a challenge, but I mean, leaps and bounds have been made for this testing. I said on one interview yesterday, people have to realize that this test is not like dipping your finger in water and saying it's wet. It's a complicated test. We have good 5-minute tests now, but they're few and far between. We're getting more of those out. What's going to be the end result? What we need is something called surveillance testing. When we're able to go out and do good public health evaluations, to look in communities and see, well, where is the virus active? And we do that with influenza all the time. And that's going to be a very, very important thing. Or again, we're not there yet, but so what measures can we do before we get all that testing done? Because to be honest with you, we're going to need to do some measures, not only for the welfare of the nation and the state, but also for the health of folks, especially for their mental health. So why don't we look at certain categories? I would submit that those over age 65 that have significant comorbid diseases, what I just talked about, they continue to stay shelter in place for the next month or so. Those age under 65 that have significant asthma, heart disease, lung disease, treatment for cancer, previous transplant, those individuals, they should continue to stay sheltered in place. But those age under 65 that are otherwise healthy, I do think there should be some move towards, migration outwards, continuing all the things that we've learned from the social distancing, the washing hands. Now we're learning that really masks do have a role here. It's not a perfect role, but they do have a role. So those individuals, I believe, can, start to approach and coming out in public. Where can they come? I've talked about this on multiple interviews, and I did, as I said, a video on Monday. I think barbershops, beauty salons, those instances where, the people are 6 feet across, you stagger appointments, you keep people separated from one another, you have the stylists wear masks. Those are things that we can do today. Even restaurants and churches, certain things that can happen in restaurants, for example. If your capacity is 100 by the health board, why don't we start out and saying, okay, your capacity is now 30, limit 4 to a table, every other table. That makes sense. Waiters and waitresses wearing masks. And churches, we live in the South. The pinnacle of a lot of folks' weeks, and rightly so, is going to church. Well, we're going to have to act things a little bit differently. Maybe have every other pew, have maybe 4 to a pew on either side. And then, I hate to say this to the pastors, but maybe more services during the day to space them out. Those age 65 and older, I would still encourage maybe to watch their services online. You know, we're a communal beast. We're a communal folks. We love to be around one another, and that's been one of the biggest challenges. I think there are ways we can be around one another, but using the experience that we've gained so far from across the world in the United States.
Yeah, so Greg, listen, I've been fortunate enough to serve with you in the North Carolina House of Representatives before you went to Congress, and you're reasonable, you're approachable. For those of us in North Mecklenburg who may not know where to find you, I know you post your videos. Where's the best way for them to go find these videos? Is it on your Facebook page?
Yeah, my Facebook page, we posted them. It's Congressman Greg Murphy. And
Okay.
if you go back on those things, you know, I go back, you know, almost 2 months when I first started talking about bending the curve and all those things. I've tried to be as apolitical, just as informative as possible, to give people information, give some, you know, opinions. And I direct this primarily as me being a physician. You know, some of this stuff, I was on CNBC yesterday. I'm on NC Spin tonight. We posted some of those videos. I've tried to just be as educational as possible. You know, I am, as you said, I've like that, and I think knowing more about the medical aspect has been able to shape what I believe is good policy.
Yeah, for sure. Well, look, thank you for what you're doing for the country. Thank you for what you're doing for North Carolina. Can't thank you enough for being a very regular panelist on these North Mecklenburg calls. Obviously, just a reminder, Congressman Murphy went to Davidson College for undergrad. He's from North Carolina, so we appreciate you. I know you have another engagement next, so I'm gonna let you hop off. But thank you very, very much for joining us today.
Great. Thank you so much, John. Thank you for doing this, and thank you for your service. Have a good day.
All right, God bless. See you, bud. Just moving on, visit Lake Norman. Just a reminder, what a great idea, virtual tip jar to help those workers that usually would get your tips, right? For whether you're sitting at the bar or at a restaurant, they're serving you. Well, right now we don't have that going on. So virtual tip jar, every time you go to this particular website, it rotates different people. So every time you go, you can give a tip to someone new. So visit lakenorman.org /restaurants and for the virtual tip jar. In closing, thanks to all of our regular panelists today. It's just myself and Congressman Greg Murphy. We had lots of panelists that had commitments for today, so we decided just to keep it simple. But just as a reminder, every Wednesday, Director Thomas Stith joins us from the United States Small Business Association, and then we have very regular folks like Mecklenburg County Commissioner Pat Cotham, Cornelius Mayor Woody Washam, Huntersville Mayor John Anarella, the CEO of the local chamber, Bill Russell, and so and then Dr. Jock Faircloth has joined us also every time. So, and we've had a few other guests as well. And so thank you. Our next briefing is Monday, April 20th. We are stronger together. Please email me your thoughts, lkntogether@gmail.com. You can follow these. I put them at Elect Bradford on Facebook, so you can follow them there. I want you to take care of yourself, take care of each other. And this does conclude today's briefing call. Thank you and have a great weekend.